Hello, everyone, and welcome to Mackenzie Health's Community Telephone Town Hall. We are live tonight with Althoff Stationwalla, President and CEO of Mackenzie Health, and members of Mackenzie Health's Executive Leadership Team. In addition, we are joined by thousands of residents from Vaughan, King, Richmond Hill, and surrounding communities who are listening in. To submit a question this evening, simply press 3 on your phone's keypad. Once again, press 3 to submit a question at any time. My name is Eric, and I'll be moderating the town hall this evening. During this live community telephone town hall, we encourage you to get involved and to submit questions and give your opinion by voting on a few survey questions. Mackenzie Health chose this format as this is an interactive town hall with you, which means we want to hear from you this evening. Althoff and Mackenzie Health's executive leadership team want to hear your feedback and opinions and have an open dialogue and discussion with you and other residents. Tonight, we want to share updates about hospital operations, how we're supporting residents across Western York Region, future plans to enhance and expand the programs and services we provide, and more. Our intention is to get to as many questions from you as possible. You can submit a question at any time by pressing 3 on your phone's keypad. Someone will take your name, where you're calling from, and your question. We're still having new people join us. I want to welcome everyone and say hello and welcome to Mackenzie Health's Community Telephone Town Hall. We are live tonight with Althoff Stationwalla, President and CEO of Mackenzie Health, and members of Mackenzie Health's Executive Leadership Team. In addition, we are joined by thousands of residents from Vaughan, King, Richmond Hill, and surrounding communities who are listening in. We want to remind everyone joining us this evening, you can submit a question at any time by pressing 3 on your phone's keypad. We have a few survey questions we'll get to this evening. You'll have a chance to vote live on those questions as they come up. If you miss any of the town hall tonight, a full recording will be posted to the Mackenzie Health's website next week. At this time, I would like to introduce Mackenzie Health's President and CEO, Althoff Stationwalla, so he can open up the town hall. Althoff, welcome. Please go ahead.
So thank you very much, Eric. Welcome to our annual telephone town hall. We're looking forward to this opportunity to speak to residents across Western York Region and hear from you this evening. We'd like to begin with the land acknowledgement. Mackenzie Health is situated on treaty lands that have been lived on and cared for by generations of the Mississaugas of the Credit. It is a traditional territory of other First Nations, including the Haudenosaunee and the Wendat. This land is currently home to many First Nations, Métis, and Inuit people today. Mackenzie Health is grateful for the opportunity to deliver essential care to patients in this territory. We have a telephone town hall at least once a year to have this important conversation with you, our community, to complement the information we share with you throughout the year through our website, social media, and regular newsletters. Before we start providing you with updates, we'd like to ask you our first question. Eric, can we start with the first polling question?
Of course, we have our first polling question of this evening. If you can use your phone's keypad to indicate your response on this question. We want to hear from you. Do you feel Mackenzie Health, which encompasses 2 full-service hospitals and various community-based locations, is meeting your healthcare needs? If it meets your healthcare needs all of the time, please press 1. If it meets your healthcare needs most of the time, press 2. If it is some of the time, press 3. If it is none of the time, press 4. And if you are not sure, press 5. So again, you can use your touch-tone phone to indicate your response. Do you feel Mackenzie Health, which encompasses 2 full-service hospitals and various community-based locations, is meeting your healthcare needs? If it meets your healthcare needs all of the time, please press 1. If it meets your healthcare needs most of the time, press 2. If it is some of the time, press 3. If it is none of the time, press 4. And if you are not sure, press 5. Althoff, back to you.
Thank you, Eric. As many of you know, Mackenzie Health consists of 2 full-service hospitals, Mackenzie Richmond Hill Hospital and Cordalucci Vaughan Hospital. In addition to our 2 hospitals, we have a number of community-based locations which provide a number of services, including urgent care, behavioral health, chronic kidney disease, diabetes education, domestic abuse and sexual assault, autism, mental health, and a reactivation care center to support alternate level care or ALC patients. Our 2 hospitals are working together to provide seamless care to patients in Western York Region and beyond. We have integrated our 2 hospitals and a network of community-based locations in a way that not many other multi-site hospital organizations have done, with our physicians and staff moving across all sites to provide seamless care to our patients. Both hospitals offer a range of core services with specialized programs. Between the two hospitals, we continue to champion our acclaimed regional programs, including the provincially recognized Cerbera Integrated Stroke Unit, the York Region Chronic Kidney Disease Program, and the Domestic Abuse and Sexual Assault Care Center of York Region. No matter which of our two hospitals, residents from across Richmond Hill, Vaughan, or King go to, you'll receive safe, quality care from our expert team of clinicians. Our second hospital, Cortellucci Vaughan Hospital, was a very welcome and much-needed addition to our community. The reality is, both of our hospitals are very busy, and we are seeing record numbers of people coming to us for care. Right now, for example, due to respiratory illness season, we are seeing more patients who need to be admitted than we have available beds for. And wait times are longer than we would like. Please know our teams continue to do the best every day, and we thank you for your patience and cooperation as we continually adjust to meet their needs. Mary Agnes Wilson, our Executive Vice President and Chief Operating Officer and Chief Nursing Executive, will provide a fuller update shortly on current hospital operations. Since becoming two hospitals, we've experienced the largest growth compared to any other hospital in the province. We've moved from the 22nd largest hospital to becoming one of the top 10 hospitals in the province. As a health system, we have also the third highest emergency department volumes in the province. We've grown even more since our last update to you during our telephone town hall in November of 2022, and we haven't stopped growing to ensure we can meet our community's needs. Since December 2019, we've grown from just over 3,000 staff to almost 5,500 staff. That's an increase of almost 21%. We've grown from 544 to 730 physicians, and we now have more than 900 volunteers compared to less than 700 in 2019. Our volumes also continue to increase between 2022 and 2023. Our emergency department volumes have increased from more than 181,000 visits in 2022 to projections exceeding 228,000 visits by the end of this year. Our obstetric volumes have increased from just over 3,500 deliveries in 2022 to almost 4,000 babies delivered in 2023. And our surgical volumes have increased from more than 10,500 surgical procedures to 13,300 procedures performed in 2023. Now, I've just shared a lot of numbers, and I hope it helps to illustrate just how much growth we're experiencing here at Mackenzie Health and how much our community relies on us. While scaling up to two hospitals and managing consistent capacity pressures has been challenging, we're proud to continuously deliver the care our patients deserve, and we're being recognized for it. This past November, we maintained our accreditation with exemplary standing for the third consecutive time, sustaining this level of quality care for the last decade. This is the highest level of accreditation from Accreditation Canada. Accreditation is not just a recognition, it is a commitment to the highest standards of healthcare services and signifies that Mackenzie Health has met rigorous criterion, ensuring that our practices align with industry-leading benchmarks to deliver safe, quality care. This past year, we also received the 2023 Excellence in Patient Safety Award from the Canadian College of Health Leaders. And we recently celebrated a significant milestone for our organization in November. Mackenzie Richmond Hill Hospital first opened on November 28, 1963. We have been caring for residents in Richmond Hill, King, and Vaughan for 60 years, and that makes us proud. We're looking forward to what the next 60 years will bring as well. While there's a lot to celebrate, it's also a reminder that we do have a 60-year-old facility that is in need of significant updates and upgrades. We also know that our aging facility is part of a rapidly growing community here in Western York Region. We're already starting some of the early planning work to determine future healthcare needs of Richmond Hill and how we can continue to grow to meet them. We'll be reaching out to you, our community, in coming months to ensure your voice is heard as we go on this journey together. Our Vice President of Strategy and Program Support Services, David Stolte, will have more to say about our future growth plans a little later in the town hall. Now, let's go to the next polling question, Eric.
Of course, Altaf, we have our next polling question. Just before we get to that, I want to remind people that we want to hear from you. You can submit questions at any time by pressing 3 on your phone's keypad throughout the town hall. Now I'm going to read a survey question, our second of the evening. You can use your touch-tone phone to indicate your response on the following question. Do you have a family physician? If not, what are the barriers to finding one? If yes, you have a family physician, please press 1. If no, you can't find one that is accepting new patients, press 2. If no, you can't find a family physician close to home, press 3. If no, your family physician is retired and can't find a replacement, press 4. If no, you don't know where to look to find one, press 5. And if no, you have another reason for not finding a family physician, press 6. So again, do you have a family physician? If not, what are the barriers to finding one? If yes, you have a family physician, please press 1. If no, you can't find one that is accepting new patients, press 2. If no, you can't find a family physician close to home, press 3. If no, your family physician is retired and you can't find a replacement, press 4. If no, you don't know where to look to find one, press 5. And if no, you have another reason for not finding a family physician, press 6. Now, for those who may just be joining us now, Mackenzie Health President and CEO Altaf Stachenwall just provided an overview of the Mackenzie Health, including a snapshot of its programs, services, and the current state of operations. If you would like to listen to a recording of the full telephone town hall, please check the Mackenzie Health website next Wednesday. Now let's welcome Mary Agnes Wilson, Executive Vice President, Chief Operating Officer, and Chief Nursing Executive, who will provide more in-depth information on current hospital operations and what you can expect from coming to Mackenzie Health.
Thank you, Eric. It's my pleasure to connect with all of you this evening and to help ensure this community gets the care that you need and deserve. We're just past the holiday season, and I'm sure that either you or someone you know has recently experienced a respiratory illness. We continue to see the impact of having many circulating viruses, such as RSV, influenza, and COVID-19 in our community, and this has resulted in more patients coming to hospital and needing care. Now, on average, we see about 650 patients daily across our 2 emergency departments in our urgent care center. But during the first few weeks of January of this year, the number of patients coming to our emergency departments increased to between 700 and up to 800 emergency visits per day. To put that into perspective, this meant that we were treating about 1 patient every 2 minutes. More patients coming into the emergency department also means more patients that needed to be admitted to the hospital and needed an inpatient bed. On January 8th, we saw 111 people admitted to our hospital waiting in the emergency department for a bed to become available. This was the highest number of patients waiting for a bed in our organization's history, and it definitely is not the experience we want for our patients or for our care team. Now, today, there were 56 people in the emergency department waiting for a bed to become available. But we continue to see more people coming to us who are very sick and needing to be admitted for care. We're doing the best we can to find the space and the staffed beds for them as quickly as possible, but this is not an ideal situation. While patients are continuing to receive the care they need, many are being cared for in unconventional spaces. We have a team that works very hard every day to ensure all patients who are ready to leave the hospital are discharged so that we have more beds available for those who need them. As Altaf said earlier, we really appreciate our community's continued patience, and our healthcare team is truly doing all they can to deliver the best care possible. The Ministry of Health projected an earlier peak for this respiratory season in late November and early December, but a longer season overall than in previous years. And at Mackenzie Health, that's been our experience. We saw an increase in COVID-19 cases beginning in late August, and we experienced 2 COVID-19 outbreaks at Mackenzie Richmond Hill Hospital and the Reactivation Care Center at the end of September. In November, we saw a decrease in COVID-19, but an increase in flu and RSV cases at our hospitals. Since then, we've had an additional COVID-19, RSV, and flu outbreaks at our hospitals this winter. When outbreaks happen, we have strict protocols in place to minimize the spread of illness. We limit the number of visitors on the unit. We use additional symptom monitoring protocols for our patients. We enhance our cleaning processes, especially for high-touch and high-use areas. And to manage these increased numbers, our teams have developed and activated plans to manage the patients we're seeing coming into our emergency departments. In November, on average, we were operating at about 108% of our capacity. That means we had 8% more patients than we had beds available. Today, our hospital is operating at 115% capacity. And at this time, we've temporarily opened 45 additional beds, and some of these beds are located in unconventional spaces. We know that being cared for in an unconventional space isn't ideal, but we're doing our best to make sure you're getting the care you need, even if it might be in a space that wasn't meant for permanent patient care. We've also implemented some innovative solutions to help manage some of these pressures, and I'd like to share a few examples with you. We've created a short-stay unit in the emergency department at the Mackenzie Richmond Hill Hospital. It's a 10-bed unit for patients who need to be admitted for care, but are expected to stay for less than 48 hours. With this approach, we can expedite getting patients the care they need so they can go home sooner and not need to be transferred to an inpatient unit, freeing beds for those who need to be in hospital longer. Another significant challenge for us is that approximately a quarter of the patients coming to our hospital don't have a primary care provider, such as a nurse practitioner or family doctor. This means that when patients are discharged from the hospital, they don't have a primary care provider to oversee their follow-up care. In October, our emergency department and family practice teams launched a family practice clinic as a pilot project at our Mackenzie Health Richmond Hill Hospital. This clinic is staffed by a family practice physician and a nurse navigator who will see patients for follow-up care who have come to our emergency department and don't have a family doctor. The nurse navigator will also help connect patients with a family physician in the community so they don't have to rely on our emergency department for their ongoing needs. This is a pilot project until the end of March, and we can support up to 200 patients enrolled in this clinic. We're always looking for ways to make programs like this permanent, and we've submitted proposals to the government for permanent funding. We also continue to work with our partners in the Western York Region Ontario Health Team to deliver integrated care for our community. An integrated healthcare system with coordination among healthcare providers, from the hospital to family physicians to rehab services and other social supports, is the best way to deliver care in our community, and we're proud of the work that we're doing together. One of the programs we deliver is called Mackenzie Health, and it's a collaboration with our Ontario Health Team partners, SC Health, CHATS, and LOFT. This integrated care program helps patients over the age of 65 transition from hospital to home, arranging all necessary healthcare services, transportation, and caregiver supports. To learn more about the Western York Region Ontario Health Team and the services available in our community, please visit westernyorkregionoht.ca. Now, I'd like to pass it over to our Chief of Staff and Vice President of Medical Planning, Dr. Jackson, to provide an update on staffing and the surgical backlog before we open the lines to questions from our community.
Thank you, Mary Agnes. I echo the sentiments of both Mary Agnes and Altaf that it is a privilege to provide care to our community, and as Chief of Staff, I am so proud of the work our healthcare team does day in and day out. As you've heard already, it hasn't been without challenges, and one of the challenges we haven't touched on yet is staffing. At Mackenzie Health, we're in a unique position as we're in a constant state of growth. As our community grows, we need to grow with it, and expanding the programs and services we offer to continue to meet your needs today and into the future. While our staffing is stable and we're able to meet the current needs of our community, it remains a challenge and a priority for us to continue to make strides when it comes to ensuring we have the healthcare workers needed to care for our community. To help our efforts, we have a recruitment and retention council made up of a variety of staff from across the organization who are charged with developing and improving our strategies to recruit and retain the best healthcare workers around. We've also seen success with our employee referral program. Since launching the program, we've hired 56 new employees who were referred by current employees. And we've expanded education opportunities and enhanced our wellness programming for our staff, creating a more positive work environment. At the end of October, we had 594 vacant positions, but as you heard earlier, our headcount increased from about 4,500 to almost 5,500 from 2021 until now. So those vacancies reflect this constant growth. One impact of the pandemic is that it's still being felt by all hospitals across the province is the surgical backlog and the backlog in creating access to these surgical procedures. We know how important timely access to surgery is for our community, and addressing the surgical backlog is a priority for us. I'm pleased to share that we've been able to make significant progress. At our peak in January of 2022, we had nearly 4,000 procedures on our wait list. As of January 18th, we've been able to bring that wait list down to just over 2,000 procedures. While we still have a long way to go, we're doing our best to work through the backlog and are ensuring that the most urgent surgeries, like cancer surgeries, are prioritized. Many of the surgeries still outstanding include total hip and knee replacement surgeries. Each day, we average around 19 surgeries in our operating rooms at Cordalucci Vaughan Hospital and around 17 surgical procedures in our operating rooms at Mackenzie Richmond Hill Hospital. The Orlando Corporation Ambulatory Surgical and Procedure Center at Mackenzie Richmond Hill Hospital has also been a game changer in helping us make progress. When our Women and Child program moved to Cordalucci Vaughan Hospital, we were able to transform that space into 12 suites to increase our capacity for endoscopy, urology, and minor procedures. While scheduled procedures in our operating rooms might be impacted by more urgent cases coming in through the emergency department, this ambulatory surgical and procedure center is not impacted by emergency cases. We are able to maintain a set, steady schedule, completing an average of 130 minor procedures per day. Since opening the Orlando Corporation Center in the fall of 2021, more than 76,000 minor procedures have been completed in that space. I also want to note that creating this space is an example of donors stepping up to give back to Mackenzie Health. The Orlando Corporation donated $5 million directed towards this center, helping to take the pressure off of our operating rooms. We are so grateful for the Orlando Corporation's support. Before we go to your questions, there was one other item that I wanted to touch on. As you've heard, while we're doing all we can to deliver the best care possible, the pressures we're facing in terms of capacity and volumes are impacting wait times and sometimes the care experience. We know this is not ideal, and we also hear from our patients and their loved ones about their frustrations. We are also looking for ways we can enhance the care experience, and you've heard a few examples of that tonight. Unfortunately, since the pandemic, we've seen increased instances of violent and aggressive behavior from patients and their families towards our doctors, staff, and volunteers. We're not alone in experiencing this increase in violence and aggression. I know many of us have witnessed it in line at the grocery, at your local coffee shop, but it's important to make clear that it's not acceptable under any circumstance. At Mackenzie Health, we are committed to delivering high-quality care in a safe and inclusive environment. In return, we ask you to be kind, respectful, considerate, and patient. Our staff, physicians, and volunteers are working hard to care for you and your loved ones, and we will not tolerate physical or verbal abuse. We appreciate the community's cooperation in ensuring a safe and inclusive environment for everyone. Eric?
Thank you, Dr. Of course, yeah. Thank you, Dr. Jackson. And now I just want to let everyone know who is joining us now. Members of Mackenzie Health leadership team have already provided an overview of the program's services and current state of operations at Mackenzie Health, including an update on current emergency department volumes, staffing challenges, and how Mackenzie Health is addressing the surgical backlog to ensure patients get their procedures as soon as possible. For everyone, I just want you to know, if you'd like to listen to a recording of the full telephone town hall, please check the Mackenzie Health website next Wednesday. It should be provided there. Also, if you have a question you would like to submit on the town hall this evening, you can press 3 on your phone's keypad at any time. Someone will take your name, where you're calling from, and your question. So again, press 3 to submit a question at any time. We're now going to go to some of those questions from the community, and after that, we'll get an update on Mackenzie Health's plan for the future, including some exciting partnerships and plans for growth. So now we're going to go to some questions that were submitted by our callers. Our first question comes from Sheila. Sheila says she's from south of Jane and Major Mac, and Sheila says that she loves Cordalucci and is concerned about the space and thinks that the room should hold 2 people instead of 1, but thinks it's a beautiful hospital and feels like a hotel.
So Sheila, thank you for your feedback and obviously the complementary nature of the facility that we've created here in Vaughan. The nature of advanced hospital design is such that the standards that are defined by the province are suggesting that single rooms are the best approach. primarily for the purposes of managing infections. So having one patient per room enables us to segregate patients and manage infections that much more easily. There are some semi-private rooms at Coeur d'Alene Hospital, and on each ward there's also a triple occupancy room. So there are a variety of rooms, but predominantly they are single-bed rooms, really for the purposes of managing infections. We've come a long way in understanding how to mitigate sort of outbreaks and the spread of viruses, and the private rooms do facilitate that. Also, from the perspective of families and patients, it does provide and afford more privacy and the ability to have a greater number of visitors. So, Sheila, I hope that answers your question. Thank you.
Sheila, thank you again for that question. Again, a reminder to everyone, you can submit a question at any time by pressing 3 on your phone's keypad. Up next, Connie from Thornhill submitted this question. Why are there not enough psychiatrists on staff in the emergency rooms?
Stephen, as our Chief of Staff and surgeon, why don't you respond to that question?
Well, thanks for that question. It's always a challenging problem when people are waiting for the care that they need, and there's a sense that they don't have the adequate resources and that there aren't enough doctors to be able to see them. It is a challenge, and right now there is a shortage of psychiatrists across the province, across the country, where we are able to staff the emergency department for those patients that need urgent care. It is something that we are striving to do better on, and we're trying to get even more psychiatrists and expand our mental health program. And as we do that, we should be able to provide even better care. But it's never great to be able to or to have to wait and to feel the pressure when someone is in need of the care. But we're doing everything we can to even recruit more and to do everything we can to make the waits even shorter.
And Constance, we will be increasing the footprint of our mental health and our psychiatry program. We will be adding 20 additional beds at the Mackenzie Richmond Hill Hospital sometime in late spring, early summer.
Connie, thank you again for that question. Up next, we're going to go to another question. This was submitted, and of course, you can submit a question by pressing 3 on your phone's keypad. Our next question is from Randall in Vaughan, and Randall's question is, what are Mackenzie Health's plans to deal with errors between oncology and the emergency department?
So thank you for that question, and I'm going to turn this over to Mary Agnes, who is leading our Zero Harm High Reliability program.
Thank you, Altaf, and thank you for that question. As you heard earlier from Altaf, we have been recognized for our commitment to reducing medical error and the harm that happens to patients and to staff. We have taken this very seriously, and we've embarked on a journey towards becoming a high reliability organization. And this means creating systems that reduce error that can happen in healthcare organizations. It means changing the way we do business. It means training all of our staff and our physicians to use tools and different approaches to working on a day-to-day basis. And while no error is acceptable, we are seeing good progress on this effort in our organization. We are reducing the rates of infection. We're reducing falls. We're reducing pressure injuries, just to name a few. And I will say that when we look at Mackenzie Health's performance relative to hospitals across Canada, we are performing at a much lower error rate than national average. And while any error is an error that we don't want to see, we are committed to continuing on this journey and reducing a medical error in our environment.
Randall, thank you for that question. Up next, we are having another question. This one was submitted by Jeff. Jeff's question is as follows. Why can't I access my chart records online like we used to in the past? Why do we need to make a request now?
So, Jeff, the MyChart application has to actually be registered into the system so you can access all of your records. So if you go onto our website, there is a process by which you will register and then gain access to all your records. Again, we encourage all of our patients and their families to use MyChart. It is a vital resource by which you can see results. At the same time, physicians see those results. You can make appointments. You can actually modify your appointments. So it is a very powerful online tool. Again, if you have any issues, Jeff, in registering, we encourage you to go on the website, and there is a help desk and a live voice that can help you if there's any issues.
Jeff, thank you again for that question. Up next, we have another question. This was submitted by Maria. Of course, if you'd like to submit a question, you can press 3 on your phone's keypad. Someone will take your name, they will take your question, and where you're calling from. So this question is from Maria. Maria asks, will the Richmond Hill Hospital be a little more wheelchair accessible?
So thank you for that question, Maria. And in terms of accessibility, we are obviously required to comply with legislation. The AOD Act is something that we post on our website and the actions that we take. As you will hear from David Stolte, we continue to refresh and renew the Mackenzie Richmond Hill Hospital. And as we look at all of those renovations, we continue to look at it from the perspective of accessibility. So we do have a number of patient advisors that continue to guide us on that journey of accessibility, to making sure that when we do renovate space, we do ensure that it is made accessible. So you'll continue to see improvements both in the aesthetics and the look of the Mackenzie Richmond Hospital, but also ensuring that it becomes more accessible as it is 60 years old and there are spaces that do need to be improved in that facet. So, Maria, thank you for that question.
Maria, thank you again for that question. Again, if you'd like to submit a question, you can do so by pressing 3 on your phone's keypad at any time. Our next question is from Gary, and Gary says, I'm a dialysis patient at Richmond Hill. The staff there is tremendous. Are there any plans for upgrades to the dialysis machines or renovations at Richmond?
So, Gary, thank you for that question. I'm going to pass this to Mary Agnes.
Thank you for that question. And absolutely, that is one of the areas that we are looking to refresh. And while you're a patient at our Mackenzie Richmond Hill Hospital, we know that we have patients in Oak Ridges, we have patients in Vaughan at our James Street site, and we are also looking to expand into our the southern part of Markham to be able to accommodate patients that are living in that area as well. But we do have plans to improve the facilities at the Mackenzie Richmond Hill Hospital. We're going to start with upgrading the basic infrastructure for water and for the machines, but there is an annual plan that we review, and we certainly have plans to do that, and look forward to you being the recipient of the improved facilities that we can offer you.
Gary, thank you for that question. Up next is a question from Rosalie. Rosalie is near King and asks, Rosalie said she would like to know if there are any unoccupied rooms due to shortages of nurses or doctors.
So, Rosalie, I think as you heard from Dr. Jackson, we've continued to recruit, and we're fortunate that we've gained almost 3,000 new staff in the matter of the last number of years as we've expanded services in Richmond Hill, but also opened the Cordalucci Vaughan Hospital. So I can tell you that we do not have vacant rooms that are not staffed. In fact, as Mary Agnes pointed out, in the last 4 to 6 weeks, we've surged up and actually put patients in unconventional spaces. So we've basically taken over other spaces that were parts of other departments like diagnostic imaging or the actual surgical program, the peri-op program, and created additional spaces there. So our issue isn't one of real estate. Our issue is one of real estate, not of actual health human resources. And as you'll hear from David Stolte, we have plans to continue to grow the footprint of both hospitals in the near future. So thank you for that question, Rosalie.
Rosalie, thank you for that question. Now, we're still having new people join us, and I just want to welcome everyone to Mackenzie Health's Community Telephone Town Hall. We're live tonight with Altaf Stationwalla, President and CEO of Mackenzie Health, and members of Mackenzie Health's Executive Leadership Team. We're taking your questions. To submit a question tonight, simply press 3 on your phone's keypad. Once again, press 3 to submit a question at any time. The other members of the panelists who are joining us this evening are Mary Agnes Wilson, Executive Vice President, Chief Operating Officer, and Chief Nursing Executive, Dr. Jackson, Vice President, Medical Planning and Chief of Staff, and David Stolte, Vice President, Strategy and Program Support Services. We're taking your questions. Press 3 to submit a question at any time. Up next, we have Anna, who is joining us now from Woodbridge. Anna's question is as follows. My mom was in the hospital and had a doctor, and when she would get used to a doctor, they would change the doctor. Why do the doctors get shifted around in the hospital so much during a patient's stay?
So thank you for that question, Anna, and I'm going to get Dr. Jackson, our Chief of Staff, to answer that question. Stephen?
Thank you for that question, Anna. It does seem stressful and challenging when the doctor that's looking after someone has to change. We do try to do as much as we can with consistency, and that certain doctors typically cover a certain ward for a week at a time, but then there are times when they just have to shift off and other physicians have to look after the patients. Understandably, no one doctor can look after the same patients continuously. There is a need to take a break, and so we try to keep the doctors as fresh and as competent and eager to continue to provide care, and so we do have to shift around physicians from one ward to another, but we do try to keep the consistency as much as possible with one physician, typically for a week at a time. Thanks again for the question.
And thank you again for that question. Up next, we have a question from Marta, whose question is as follows. Marta is from Maple. Marta asks, why did it take so long to receive a CTC scan? It has taken over 2 months for me and still waiting.
So Marta, that's a great question, and it is a challenge. We have obviously, as Stephen pointed out earlier, Dr. Jackson, challenges around both the surgical backlog and a diagnostic testing backlog. What will typically happen is that your requisition will come from a family physician. It will be screened by the radiologist, so the radiologists do triage the CTs, MRIs, X-rays, depending on the diagnosis and the urgency of the case. So there is a bit of protocoling that happens, and then they try to see you as quickly as possible. I encourage you that if the wait is too long, you can always ask the radiology department, medical imaging department, to put you on a wait list. If there are cancellations, they will call you if you're able to come quickly, so that slot can be filled and you can be seen more quickly. But it is a challenge, obviously, in terms of the backlogs and catching up, and just in general, we would like the waits to be shorter, but we're doing our very, very best. So thank you for that question, Marta.
Marta, thank you again for that question. And of course, for everyone joining us this evening, if you'd like to submit a question, simply press 3 on your phone's keypad. We would like to hear from you this evening. Once again, press 3 to submit a question at any time. Someone will take your name, where you're calling from, and your question. Up next, we have a comment from Regina. Regina says, Regina would like to thank the hospital for everything that they did for her while she was in the hospital for about a month. She felt very cared for during that time, and she says, thank you. We have had a few other comments from other people about they want to express their thanks to the healthcare team as well.
So thank you, Regina. And I know that many of our staff are probably also listening in on this teletown, so I know they would appreciate your thanks. Again, anything you can do to share feedback to our staff, we do share it with them so that they can be acknowledged and congratulated for the care that they do. So we will ensure that they do get this message. Thank you again, Regina.
Regina, thank you again for those comments, and thank you to everyone for sharing those comments. Up next, we have a question from Dina. Dina is from Young and King, and Dina's question is, as part of the OHT, do they have family advisory committees that look beyond the doctors and look at the whole network?
So, Dina, part of the Ontario Health team that we have, the Western York Region Ontario Health team, we do have patient advisors. So we have, I think, 4 or 5 patient advisors that sit on the OHT that actually provide us with the perspective of a community member. And obviously, these are patients from a variety of different diagnoses that actually ground some of the work that we do. In fact, we have a group of meetings tomorrow where we have a number of these advisors helping us shape the kinds of programs and services that we need to deliver, but more particularly how we shape those programs from the perspective and the eyes of a patient. So we do have a number of these advisors. We also have them within the hospital as well. We absolutely believe that the voice of the patient and families is paramount in ensuring that we design services that align with the needs of our community, and that is reflective not just from the provider's perspective, but reflective of what patients and family needs to deliver care that's more comprehensive, but also more aligned and more patient-centered. So thank you for that question, Dina.
Dina, once again, thank you so much for that question. Now, what we're going to do now is I'm going to do another polling question. So the polling question is as follows, and you can use your touch-tone phone to indicate your response on this question. Our community in York Region continues to grow at a rapid pace with a population expected to grow to more than 2 million by 2051, an increase of 63% from 2022. Assuming sufficient funding, where do you think Mackenzie Health needs to focus its attention to keep up with the growth to support the community's healthcare needs? If it is by expanding programs and services at both Cordalucci Vaughan Hospital and Mackenzie Richmond Hill Hospital, please press 1. If it is by expanding programs and services at Cordalucci Vaughan Hospital, press 2. If it is by expanding programs and services at Mackenzie Richmond Hill Hospital, press 3. If it is through integrated care with community health partners, press 4. If it is none of the above, press 5. So again, our community in York Region continues to grow at a rapid pace with a population expected to grow to more than 2 million by 2051, an increase of 63% from 2022. Assuming sufficient funding, where do you think Mackenzie Health needs to focus its attention to keep up with the growth to support the community's healthcare needs? If it is by expanding programs and services at both Cordalucci Vaughan Hospital and Mackenzie Richmond Hill Hospital, please press 1. If it is by expanding programs and services at Cordalucci Vaughan Hospital, press 2. If it is by expanding programs and services at Mackenzie Richmond Hill Hospital, press 3. If it is through integrated care with community health partners, press 4. If it is none of the above, press 5. Now let's welcome, what we're going to do is we're going to welcome Mackenzie Health's Vice President of Strategy and Program Support Services, David Stolte, to provide updates on Mackenzie Health's growth and future plans. David?
Thank you, Eric, and hello, and thank you everyone for joining us this evening. As you have heard in the polling question, York Region is one of the fastest growing communities in the country, with a population expected to grow by more than 35% over the next 20 years. The municipalities in our catchment area are growing at a rapid pace, and that has an impact on the healthcare services we provide. Mackenzie Health needs to continue to plan for future expansion and growth, especially given increased density in areas like the neighborhood around Yonge Street and High Tech Road in Richmond Hill and the Vaughan Metropolitan Centre. Becoming 2 hospitals allowed Mackenzie Health to double access to care for our communities, but we need to continue to grow and expand the programs and services we provide to meet the needs of our residents in the communities we serve. Our hospitals are already operating at or over capacity on most days, and we quickly surpassed the projected number of patients we expected to care for soon after we opened our second hospital. We're actively planning for the future to ensure we're prepared to meet this community's needs. As part of that planning work, we'll be reaching out in the coming months to engage you on what's next for Mackenzie Health as we consider the best way to support our community into the future. It's so important to us that the voice of the community is heard and our community's perspective and input is embedded in all that we do. While we know there's a lot of work that needs to be done to plan for the future, there's a lot that we're already doing now as needs arise. As an example, last spring, our pediatric urgent care clinic expanded to a second location at Mackenzie Richmond Hill Hospital to provide rapid, specialized care to kids referred from the emergency department or from family physicians. With the increased number of pediatric patients needing follow-up care, this second clinic was needed. Since opening, there have been more than 6,800 visits across both hospitals to the clinic. We're able to care for more kids closer to their homes in Vaughan and Richmond Hill. In the fall of 2022, we also launched a new regional program by gradually opening a long-stay critical care patient unit at Cortellucci Vaughan Hospital. This is a specialty unit for patients who aren't in the most critical phase of their recovery and no longer need care in a traditional intensive care unit, but who still need help getting off of a ventilator so that they can begin breathing on their own again. The goal for these patients is to get well enough so that they can go home or continue the recovery at a rehabilitation center. With these patients receiving care in a specialty unit where they receive breathing support and rehab and physical therapy sooner, we can keep more traditional critical care beds available for the critically ill patients who need them the most. We're one of only 2 hospitals in the GTA to receive patient referrals from across the region to support these patients. To date, we've helped more than 50 patients in the program. We also continue to refresh and update Mackenzie Richmond Hill Hospital, which, as was mentioned earlier, just celebrated its 60th anniversary. Ensuring both of our hospitals are welcoming and in good condition for staff, physicians, volunteers, patients, and their families is part of ensuring a positive experience for everyone who comes through our doors. Thanks to government funding through programs like the Health Infrastructure Renewal Fund, we've made necessary upgrades to our emergency generator system and transformer. These important upgrades will help us continue to deliver care to patients without interruption in the event of an unplanned outage. More work like this is needed and will continue. In 2022, we also began the first phase of a refresh of Mackenzie Richmond Hill Hospital, starting with patient care units and the atrium in the A wing. This will help us deliver on our vision to help seniors and those with complex care needs access the support they need through safe, responsive, and individualized care. It's so important that we continue to care for seniors in a way that preserves their dignity and treats them with respect at every stage of their journey with us. And a welcoming space to receive that care helps us do that. Our newly refreshed A-Wing is now home to our Center of Excellence for Continuing Supportive Care, which is allowing us to care for patients with complex chronic conditions all in one dedicated location so we can support patients through transitional care and discharge and palliative care when needed. Our palliative care patients moved in at the end of April 2023, and complex care and rehab patients moved back from our reactivation care center in October 2023. Staff, patients, and their families now benefit from an improved physical environment with new floors, furniture, doors, handrails, and hardware, a new nursing station, updated washrooms, and family lounge areas, as well as fresh and updated paint and signage. Investing in our hospitals to create a more comfortable environment for everyone who enters the hospital is a priority, and we're ready for our staff, patients, and visitors to experience these refreshed spaces now that they've been completed. As many know, our funding comes from many places. We're grateful to our government partners for their investments to support our operational funding needs and a significant portion of our capital needs. We also rely on the generosity of our community to help support our highest priority capital needs, like refreshed spaces and leading-edge equipment and technology. This project would not have been possible without donor support. One of our cherished donors, who prefers to remain anonymous, believed in our vision of a Center of Excellence for Continuing Supportive Care so much that she made a significant contribution to help bring it to life. And that is part of that vision. And this is part of that vision. We're so grateful for this support and for the support of all of our incredible donors. Moving from Richmond Hill to Vaughan, I also wanted to provide an update on the Vaughan Healthcare Centre precinct, which encompasses the lands surrounding Cortellucci Vaughan Hospital. We continue to work with our partners, the City of Vaughan, York University, and Venture Lab, to create a centre of healthcare excellence in York Region on these lands adjacent to Cortellucci Vaughan Hospital. The precinct offers a unique opportunity for us to collaborate and make a lasting contribution. Working together, we can support the needs of our growing community. Planning work is progressing as we continue to build on this vision and extend the healthcare footprint in Vaughan. We also continue to explore additional services for seniors. We're grateful for the provincial government's approval of a 256-bed long-term care home, which will be located in the precinct, and we expect shovels in the ground by late 2025. We're also pleased to offer our support of York University's proposal for a School of Medicine. York University continues to have positive conversation with government about their proposal to establish a new type of medical school focused on primary care. Now more than ever, the province needs to consider new ways to attract and retain primary care doctors, and we believe the proposed York University Medical School will positively contribute to addressing this challenge. We know that primary care physicians, be it family doctors or nurse practitioners, are much needed in our community. As you heard earlier, we see the need firsthand every day when patients come into our emergency department and they don't have access to a family doctor. We're excited for what lies ahead and look forward to continued collaboration with our partners to achieve our shared vision. Before we move to our next polling question, I just wanted to thank our community again for your support of Mackenzie Health and for trusting us with your care. We are all so proud to be part of this community. Thanks, Eric. Back to you.
Of course, and we have some more questions coming up. Now, for those who may just be joining us now, members of Mackenzie Health's leadership team have already provided an overview of the program's services and current state of operations at Mackenzie Health, including an update on current emergency department volumes, staffing challenges, how Mackenzie Health is addressing the surgical backlog to ensure patients get their procedures as soon as possible, and Mackenzie Health's plans for the future. If you would like to listen to a recording of the full telephone town hall, please check the Mackenzie Health website next Wednesday. We're now going to go to a few more questions submitted from the community and also some more polling questions. After that, we will welcome back Mackenzie Health President and CEO Altaf Stationwala to say a few final words. So up next, we're going to do another survey question, and you can use your touchtone phone to indicate on a scale of 1 to 5, how important is it to you for Mackenzie Health to explore and expand any of the following clinical programs or specialties? 1 is the least important and 5 is the most important. So, first, how important is it for Mackenzie Health to explore and or expand seniors' care? If it is not important at all, please press 1. If it is somewhat important, press 2. If it is important, press 3. If it is very important, press 4. And if it is the most important, press 5. So again, on a scale of 1 to 5, how important is it for you? Is it for Mackenzie Health to explore and or expand seniors' care? If it is not important at all, please press 1. If it is somewhat important, press 2. If it is important, press 3. If it is very important, press 4. If it is the most important, press 5. Our next question was submitted by Jill, and Jill's question is as follows. Jill from Thornhill. Jill would like to know, what can we do about the long wait times at the ER? We can't just sit around for 9 to 10 hours each visit.
Sorry, Eric, can you repeat the question?
Of course. So Jill's question is as follows. Jill would like to know what we can do about long wait times at the ER, and it says that we can't sit around for 9 to 10 hours each visit.
So thank you, Jill, for that question. And I think as Mary Agnes expressed a little bit earlier in her opening commentary, it all is dependent on what's happening on any given day. As you heard from her, on any given day, we could see 700 to 800 patients across our EDs. That could be in the range of 2 patients a minute. So it is very much dependent on what's going on. We see a high volume of ambulances, anywhere from 40 to 50 ambulances across our ED departments. So if we see a surge in ambulance activity or very critically ill patients, it does start to impact other parts of the emergency department. It is also dependent on other tests that you may need. So if you need diagnostic tests, if you need blood work, again, those results sometimes take time to get processed, and then obviously then they have to be reviewed by a variety of physicians. In no way are these wait times ideal. We don't think they're acceptable. We continue to do the best we can to shorten those wait times. And as you know, the entire system right now is in a surge situation where it's becoming very challenging to accommodate the volumes that we're seeing. So we are seeing a slight decline, as Mary Agnes pointed out. Early January, we had about 111 patients waiting for a bed one morning. Today, that's in the 50 to 60 patient range. So things are slightly less challenging, but the waits are still long. And for that, Jill, we absolutely apologize. We know how distressing it is for you and family members as you wait for results and as you wait for a diagnosis from a physician. So we do apologize. We are doing our very best.
Jill, thank you again for that question. Up next, we're going to do another survey question. Again, we want to know, using a scale of 1 to 5, how important is it to you for Mackenzie Health to explore and expand any of the following clinical programs? So, again, scale of 1 to 5, how important is it for Mackenzie Health to explore and or expand stroke care? If it is not important at all, please press 1. If it is somewhat important, press 2. If it is important, press 3. If it is very important, press 4. If it is the most important, press 5. So again, on a scale of 1 to 5, how important is it for you for Mackenzie Health to explore and or expand stroke care? If it is not important at all, please press 1. If it is not important, press 2. If it is important, press 3. If it is very important, press 4. If it is the most important, press 5. Up next, we have questions that have come in from both Maria and Barbara asking about emergency department staffing in particular. How many doctors and what percentage of nurses work in the emergency department? The staff is amazing, but it does look like they are overloaded.
So thank you, Maria and Barbara, for that question. I'm going to pass this on to Mary Agnes. Mary Agnes?
Thank you, Maria and Barbara, and a great question. And the best way to answer that, I think, is to think about the comments that I made earlier in terms of the number of patients that we see on a regular basis. We do increase our staffing and fluctuate our staffing to try to match the peaks and valleys of people arriving to our emergency departments, but that's not always a perfect science. And so depending on when you are coming into our emergency department, the time of day, the day of the week, there may not be a perfect match. I will say that for the most part, our emergency department is fully staffed during times of peak activity. So over the holidays, we staffed up both with nurses and with doctors. But when the volumes increase beyond what we even had expected, it becomes challenging to see anyone. So from last year to this year, we've seen a 120% increase in the number of patients coming to our emergency department. We continuously recruit both nurses and doctors to work in that area. I will say that in terms of our patients who are high acuity and very ill, we are meeting the timelines for those patients. On average, it still is under 2 hours to see a physician when you come into our emergency department, and we're managing to get our ambulances, patients off the ambulances and the ambulances back out into the community under 30 minutes. But it's something that we continue to look at and apologize to the community for your wait, but we're very much aware of that and continue to plan for it.
And Maria and Barbara, the other thing that sometimes becomes challenging from a staffing perspective, unfortunately, is that when we have surges in respiratory illness, for example, our staff are also living in the community and also getting sick. So that puts further pressure on the hospital when we have a lot of sick patients, but we also have a lot of sick staff, and we're still trying to staff the hospital. So it can be a challenging period, especially during the winter. So thank you for that question. Back to you, Eric.
Marie and Barbara, thank you again for that question. We're going to do another survey question, again using a scale of 1 to 5. We want to know how important is it for Mackenzie Health to explore and or expand cardiology. If it is not important at all, please press 1. If it is somewhat important, press 2. If it is important, press 3. If it is very important, press 4. If it is the most important, press 5. So again, using your touchtone phone on a scale of 1 to 5, how important is it for Mackenzie Health to explore and or expand cardiology? If it is not important at all, please press 1. If it is somewhat important, press 2. If it is important, press 3. If it is very important, press 4. If it is the most important, press 5. Up next is a question submitted by Joan in Vaughan. Joan says, Joan would like to know if the hospitals can look in the computers on the person's OHIP card instead of asking them a bunch of questions, mainly for people who have a lack of English or just cannot speak well. Can they see records from everything, doctor's offices, hospitals, and also would like to thank Mackenzie Health for everything.
So thank you, Joan. I'm going to get Dr. Jackson to talk about our electronic medical record and to answer your question.
Thanks, Joan. I think that's a really great question that a lot of people wonder about. There is possibly a perception that a lot of information is accessible through your OHIP card, but it actually isn't. Every hospital has their own independent electronic health record system. Many of the hospitals do have systems that talk to each other, and the province has implemented a certain amount of information that is accessible through a database across the province, but not every hospital has access to it. I know it can seem frustrating when the same visit, a nurse, a doctor, and other people are asking the same questions over and over again. It can seem repetitive and redundant, but a lot of this is for safety reasons, as Mary Agnes spoke to before, trying to establish systems that decrease the risk of any error occurring sometimes means that we have to ask the same question 2, 3, or even 4 times to make sure that an error doesn't slip through. So while it may seem frustrating and concerning, a lot of information really isn't automatically available, but what is available on the electronic health record through the hospital, all of our staff have access to it wherever they are in whatever ward, and that information is very important to make sure that you get the best possible care at any time. Thanks again for the question.
Joan, thank you again. And now we're going to go to another survey question. Again, on a scale of 1 to 5, you can use your touchtone phone to indicate how important is it for Mackenzie Health to explore and or expand cancer care. If it is not important at all, please press 1. If it is somewhat important, press 2. If it is important, press 3. If it is very important, press 4. If it is the most important, press 5. So again, on a scale of 1 to 5, how important is it for Mackenzie Health to explore and or expand cancer care? If it is not important at all, please press 1. If it is somewhat important, press 2. If it is important, press 3. If it is very important, press 4. If it is the most important, press 5. Up next, we have a question submitted by Cheryl in the King area. Cheryl says, is the staffing shortage a result of applicants not being suitable or funding issues?
So Cheryl, the staffing crisis, it's a very interesting phenomenon that happened. We entered COVID in a reasonable place and kind of got through COVID, and I would say that as an entire sector and system, everybody stepped up and did what needed to be done, and people worked extra hours. Many people came back from retirement. Post-COVID, we've just seen a massive exodus from healthcare, and it becomes a tricky, slippery slope when you become short-staffed, and then you put greater burden and greater workload on the staff that remains. So getting to a stable environment is critical. We are in a good place at Mackenzie Health where we do have stable staffing. It has nothing to do with funding. In fact, we've had tremendous support from the provincial government in terms of funding and special programs to introduce new workers into the workforce, whether it's enhanced support for nursing. So, for example, many of the hospitals, including Mackenzie Health, have an extern program where we bring nurses in their 3rd and 4th year into the workforce environment. They are a vital support to providing care, but they're also actually learning skills earlier, and ideally then they become a recruitment opportunity for the organization that supports that extern. So we're getting to a place, but just like many other sectors that we've seen post-pandemic, staffing has been a challenging, and matching our workforce to the needs continues to be a challenge. So it is getting better. It will take some time to sustain the needs, and I think what makes it challenging is the compounding fact in our region of population growth and aging, which puts greater pressure on the growth. And I think you heard from David and others that we continue to grow and the needs continue to be increasing in our community. So it's just really keeping up with demand. But it is a challenging phenomenon, and it's not unique to the GTA, Ontario, Canada. It is a global issue in terms of healthcare staffing. So thank you for that question, Cheryl.
Cheryl, thanks again for that question. We'll go now to a question submitted by John. John asks, a doctor ordered an MRI and a follow-up appointment in April, but the MRI appointment is in August. What do we do?
So I'm going to turn that question over to David Stolte.
Hi, thank you for the question around MRI scans and the wait time associated with it. Mackenzie Health does operate 4 MRI machines, 2 in Richmond Hill and 2 in Vaughan. The scans are done on a priority basis, and we're still dealing with some backlogs associated with the pandemic. So with the prioritization of MRI scans based on the deeming of the necessity, the most urgent and emergency cases are seen in the appropriate times, and unfortunately those that aren't in that case do take a long time, as evidenced by your call. That is unfortunate. We are making use of every dollar that the government does supply to us to operate the MRI machines. We are operating them efficiently. They're operating at full tilt, but unfortunately there are wait times associated. If you're available to, and if you are flexible, you can contact the radiology department to be on a cancellation list, so that if a appointment is somebody else's appointment is canceled, they will call out to those on a cancellation list, and sometimes that can be a way with people's flexibility to get a scan sooner. So thank you for your call, and just hope that context is helpful.
John, thank you again for that question. Up next, we have a question submitted by Norma from Vaughan. Norma's question is, what available services are there for mental health patients' families to help and support them with family dynamics?
So, Norma, I'm going to pass that question on to Mary Agnes. Mary Agnes?
Hi, Norma. Thank you for your question. And I do want to acknowledge that today is Bell's Health Talk Day, and so it's a very important question for us. We know that 1 in 4 people have mental health challenges within York Region, and that makes it challenging for them and for their families. And want to remind people that if you are experiencing a mental health crisis, feeling that you can't cope or you're not in control, please reach out to York Region and South Simcoe's Community Crisis Response Services that are available 24 hours a day and 7 days a week, or you can come to your nearest emergency department or call 911. We provide a variety of clinics and day programs to help support patients that are experiencing mental health issues in our community. So we have for example, our aftercare clinic, our psychogeriatric assessment clinic. We have our adult intake and urgent care clinic, our integrated mood disorders clinic, and our Stepping Stones clinic that provides group therapy for patients. So part of accessing those services, of course, is to be referred into them. And as we also discussed earlier, we recognize that despite all of these services that we have available, it is not enough to meet the growing need and demand. And so we are working to expand our offerings for mental health patients in the region and look forward to expanding our inpatient mental health unit and some of our clinic programs later this spring.
Norma, thank you again for that question. Up next, a question submitted by John in the Vaughan area. John's question is, what kind of cardiology services are offered at Mackenzie?
Going to pass that on to Mary Agnes. Mary Agnes?
Thank you, John. Also an important question. So as a community hospital, we certainly offer cardiology services through our emergency department. So if you're experiencing an acute event and you think you're having a problem, please come to our emergency department and you will be seen and cared for. We have inpatient units that offer care for patients with cardiac issues. We have a critical care cardiac unit for patients who need ICU level care, and we have two telemetry units for monitoring patients as well. We have a variety of diagnostic services that we provide for patients, as well as we have ambulatory clinics at our 955 location that offer a variety of services, from our rapid access cardiac clinic that will see patients who have been referred from emergency department and need some more urgent workup, all the way through patients who are living with cardiac disease and need rehabilitation, who can attend our cardiac rehab program. We're also looking at overall the offerings for cardiology that we have available at the hospital, and are looking to grow our program and expand access for patients, as we know that our community is growing and aging, and an increase in cardiac disease goes hand in hand with an older population. So thank you for that question.
John, thank you again for that question. We have another question. This one is submitted from Vito, Vito from Oak Ridge. Vito says, what can we do to help hospitals better serve the community?
Sorry, can you repeat that question, Eric?
Of course. Vito's question is, what can we do to help hospitals better serve the community?
Well, there are many ways you can help. Obviously, one area that I will speak to later is the community support for fundraising. So as you know, equipment and technology and facility renovations are very much needed in all of our locations, and community donor dollars are critical to making those projects happen. So that is a critical way in which the community can help us. Your voice and your feedback are always important, so we have a number of vehicles by which you can communicate and help us better understand what your needs are, how we can make services better. Community surveys, as you heard from David, we will be doing a lot more engagement in Richmond now as we look at future expansion for services. So staying engaged. Volunteering is another great way to give back to the hospital. We have over 900 volunteers today. They give of their time, they give of their compassion, their care, their connection to patients and families, everything from wayfinding in the hospital to supporting clinics to being a helping hand or a voice to a patient or a family. So again, we encourage you to go on our website. There are many ways in which you can help, volunteering on committees, becoming a patient advisor. Again, many ways. Please do get in touch with our public affairs department as well if you would like to find other ways in which you can contribute. And even listening in today is a very important way in which you're giving back to this community. So thank you.
Vito, thanks again for that question. Up next, a question and a comment from Tammy from Richmond Hill. Tammy wants to say thank you to the hospital and has a question that says, would you ever expand into a separate building with less urgent needs?
So, Tammy, in fact, we have done that. So at our Jane location, which is Jane and Rutherford, we actually have an urgent care center that runs from 4 to 10 p.m. every weekday and from 10 a.m. to 4 p.m. on weekends. It is a great way in which you can see an emergency doctor with an emergency nurse with diagnostics also available, and enables you to deal with less urgent issues. If by any reason your issue is more critical, then you will get triaged and referred into the main emergency department at Cordelucci Vaughan or Mackenzie Richmond Hospital. So our patients find the waits a little less because you're not in an environment with very, very acute patients. So the the flow is a little bit better, and we see on average about 50 to 60 patients every day in our urgent care center located on Jane Street at Jane and Rutherford. So thank you for that question.
Tammy, thank you again for that comment and that question. Now, Altaf, we've actually just about reached the end of the town hall. We have a couple minutes remaining. Did you want to share some concluding remarks with the listeners?
Okay, so thank you so much, Eric. And thank you again for joining us. It is so important that we take time to not only provide you with updates, but also hear directly from you. Your input helps us enhance the work that we do and is very valuable to us. We are also grateful to our partners at all levels of government for their ongoing support. And I want to take a moment to thank all of the donors who are so critical to ensuring Mackenzie Health can continue to offer the health care our community needs and deserves. Donations from the community makes a difference in our patients' lives. Because of our donors, and you heard a few examples of this tonight, our community has access to the very best health care. Mackenzie Health Foundation recently launched the B campaign to raise funds and awareness within our community about the urgently needed equipment required at Mackenzie Health. Right now, they have a goal to raise $5 million over the next few months to fund urgently needed equipment such as ultrasound machines, vital sign monitors, and surgical tables. In the coming months and years ahead, powered by the incredible generosity of our donor community, we have exciting plans to launch groundbreaking initiatives to enhance patient care for our unique and diverse population. We hope you will join us. You can learn more at mackenziehealthfoundation.ca. Thank you for joining us this evening. If you missed any of this evening's telephone town hall, we'll be posting a full recording to our website next Wednesday. Feel free to reach out to us on social media or by email at publicaffairs@mackenziehealth.ca if you have any questions. Thank you for giving up your time this evening. Thank you for your contribution. Thank you for your questions. Have a safe evening. Back to you, Eric.
Once again, we just want to thank everyone for joining us this evening. If you still have any questions, concerns, or feedback that you would like to share with Altaf and Mackenzie Health's executive leadership team, you can do so by emailing publicaffairs@mackenziehealth.ca. Just a reminder, you can email questions, concerns, and feedback to publicaffairs@mackenziehealth.ca. Thank you once again to everyone for joining us this evening, and have a great night.